Everybody, yes, I know, going to say back in my car. Okay, so I'm not even going to say that this week. But look, we will take it week by week. I know we talked about month and pat ourselves on the back, and so we should, again for this week. However, I think we need to take it week by week, considering all the hot spots. Now, just to clarify, first of all, our masks. Yes, I did send a directive out via the team in the office and Liz, Hucker, and those and everybody else. However, one of the things that we probably didn't address, because it was a government directive, but mainly for public hospitals and public health services. That doesn't mean to say we don't follow it, especially looking at all the aged care facilities in poor Victoria. Don't we feel for those people in aged care and their families? It must be horrendous for them and for the staff. There's over, 100 people, 100 health workers who have contracted COVID and who are off work and not well. Right from a little neonatal baby through to aged care and families where they just haven't been able to say goodbye. We don't want that to happen with our service, and it's not going to happen because all of us have been so vigilant. You've been so good. This is really the hardest time because we're really fed up with talking about COVID and listening to it, I'm sure. However, my job is to keep us all safe, keep us in jobs, and look after the clients and the patients. That is really, really paramount to me. So masks, I've got mine out again. Even Woolworths and Bunnings in Victoria, and they're even looking at it in New South Wales, are really, making it a mandate to wear the masks. As I said last time, you were ahead of your time because we were wearing masks back in March. When people were laughing at us, I know they were. There were staff that reported to me, even healthcare workers were saying to them, why are you wearing masks? Are you sick? Well, no, we weren't, and so forth. So we've still got them, which is fantastic. So can I say to you, please, if you're doing personal hygiene, if you can't keep your distance from the client or the patient, put on your mask. It's really, really important. If you're cleaning, though, which was raised early this morning, and you are vacuuming and cleaning, and I know what that's like, getting in the bathroom, washing floors, doing things, a mask is really a pain. I get it. I do get it. So if your patient or client is in the other room or not in any distance and you're vacuuming and cleaning, and I doubt they'd be hanging over your shoulder. I hope they wouldn't be. Please, you can leave your mask off, okay? It's going to be something I've been talking to Liz. I'm going to talk to Sharon again tomorrow, Liz Hucker, that if we, and Shaz, your clinical care manager, that if we look at those things in regards to perhaps going to the house and asking them first if they've been to any of the hot spots, if they're unwell in the household before we go in and make a decision. And that will help with the mask as well. So we're just trying to put some more things in place as to keep up with this virus. It really is an insidious virus, isn't it? A little neonatal baby, what a horrendous thing that is for that baby and the family. We're saying lots of prayers for that baby and for everyone for that matter. However, once it gets hold, as you can see, over 500 cases now in Victoria in aged care. That's how quickly, within days, that this has spread. There's been 6 deaths today. However, I know for a fact that there's 22 others that possibly are very unwell at this point of time. So, masks, gloves, if you're not sure how to use them, please come and see Sharon. Ask myself, I'll hop in my car, gladly come and show you how to use them properly if you're unsure. Or meet you at the office or at a client's house or something. Just let me know. I'll let Sharon know if you feel more comfortable with Shaz, or one of the other team, the RNs or ENs. Beautiful Di. She'd be only too pleased to show you how to do things as well. So please just feel free to contact me at any time, or of our team, our clinical team. Okay, so that's it about that. The hotspots are coming out in your iPads. Please stay vigilant. I know it's difficult. We want to have a social life as well. However, unfortunately, to give you an example, it's my dad's birthday today. Only 2 people could go in and celebrate his birthday. So that was unfortunate. I was lucky enough to see him on Sunday, but what I'm trying to say is that we can't do everything we want to do. And him included. He wanted a big party. But, of course, we had to explain to him that's not going to happen, Dad. Okay, so moving on, just another thing I wanted to mention that's coming up. We've got Share the Dignity, a charity that I really try and support. And that is, in our office, we'll have a box to be able to put women's sanitary items, handbags with shampoo in it. They've requested. Mini girls tampons. That's really important because there's a lot of young girls who want the slender tampons and the slender pads that are homeless at the moment, or who family, they're in dire straits. Not everyone is lucky enough as we are to have a job, and that's what I'm vigilant about, to try and also keep and diligent to try and keep you in a job and our patients safe. Because you can imagine if one person has COVID and moves from house to house and it's not discovered for 14 days, and things could be really bad. We'd have to shut our service down to be safe. So I often think of these poor people too that are homeless, and that Share the Dignity has got a lot of charities waiting. So in the office from the 1st of August, there's going to be a box there. Obviously, we can't go in the office, but please, what we can do is have the box near the door. So when you can just open the door, let Anne know, or whoever's at the desk, it's okay, guys, I'm just putting some female products or male products, what in there. When I say male products, I've got some male pads. No, we haven't got males having menstruation problems as yet, but male incontinence pads. And so we're going to put those in there as well, because they have a lot of homeless men, obviously, and those pads will be put to use there. But mainly what they're after is full-size shampoo and conditioner. So if you can afford to part with some of that, or if you've got the little hotel ones, that's great too. They can slip those into some packs, pamper packs that they've got. But at the moment, there are so many people waiting on this. People from domestic violence, people that are homeless, and just people who are in need of these products. So please support the cause. I'm going to put it on Facebook as well. I notice a lot of people don't go on our Facebook page, which is a shame. So I really try and encourage you to do that. And I'll also get it to go on your iPad. So please support it. If you've got a handbag that you don't need anymore, that's not too shabby, because it's going to go to a lady, and put some shampoo in it or some products in it would be really wonderful. So thank you for supporting this cause, and for these women who are destitute, and for young ladies as well, for young women who need these slimmer ones. They've got a really short supply of the slim tampons and the slim pads. So that's it for me. You know how to wash your hands. To stay safe, take care, and contact me at any time. Thank you. Bye.